Our next speaker is Phil Rains. I've known Phil in the government for a number of years, and he was always really persistent. He was always wanting to meet and always wanting to talk about children's rights. And he was quite right to do so, because he's now the acting Deputy Director of the Children's Rights and Wellbeing Division of Scottish Government. So this government, as Minister has already said, has such a commitment to children's rights that we actually have a division of government headed up and titled Children's Rights and Wellbeing. No other government, I think, in Europe has just that focus on children's rights. So Phil is here to tell us about the Children and Young People Act, rights and getting it right. Thank you, Phil.
I think with the amount of acting you're getting in the titles of people, actually, it sort of feels something like something of an Oscar ceremony. I'm in a strange position standing up now because I was the civil servant who wrote the minister's speech. So I can tell you, you're lucky. You got a much better speech than you might have gotten otherwise. And I'm lucky because I have two speeches I could use. But I'm going to stick to the one I wanted to start with. And that is to say something about the Children and Young People Act. And I want to do that by rising to the challenge that, in a sense, the two Jerrys have set for us. Jerry McCartney, by picking up those data and those statistics about the journey we have to travel with inequalities, health inequalities. And to pick up on what Jerry McLaughlin was saying about the A word. But the A word he was talking about was austerity, and the A word I want to talk about is ambition. Now, the Children and Young People Act is ambitious because it's huge. It's something like 18 different sections, and each section deals with a different aspect of a child and young person's life, some of which is universal, covers every child and young person, some of which only deals with children of a particular age group, such as the child care, some of which only deals with particularly vulnerable children and young people, such as some of the measures and provisions on looked after children. But I want to pick out on two of the major sections, two of the major aspects of it, and it's easy because they're the ones that got the word right in it. And I wanted to say something about what the ambition is. And by saying it, I'm reflecting on the fact that I'm talking about it as if it's some major change program, some revolution, which it is. And for a lot of people, that will sound scary. But I think speaking to this group in particular, you'll look at this and say, and you'll nod, and you think, actually, we've been doing this for years. Actually, what you're simply doing is you're putting something about the way we work and the way we act as early years professionals onto a statutory basis. Now, I want to start with getting it right for every child. The provisions, which I'm sure you're familiar with in the Act, coming under Parts 4 and 5, set up a named person service, or access to a named person service, for every child up to the age of 18 across Scotland. That's a big thing for the health service, because up to the age of 5, that named person service will come within the responsibility of the health board. And that means health visitors, for the most part, family nurses, many of you within this room, will be acting on behalf of the health board in taking forward that named person service, as acting as that person who is the first point of contact for children and families where concerns about well-being arise, but also the first point of contact for concerns coming from other professionals, the person who has the oversight of what may be going right, but also maybe what's going wrong in a child's life. The Act also has important provisions about the way those kind of concerns are shared, information shared across different professions. And while all of this is perfectly in keeping with existing legislation and existing advice from folk like the Information Commissioner's Office, it is, by putting it in statute, by putting the named person there, it's drawing an attention to it in a way that some people kind of sit up straight and take a sharp intake of breath. And then lastly, there are a set of provisions about those children who do need a bit of extra help, who may be getting help from different services, having a child's plan, a single way of bringing together those different services, those different interventions, rather than having them scattered across different service planning procedures. Now, the journey to get here, to the Children and Young People Act, in the civil service, we kind of like to we like to present and write speeches, and this is probably the speech I wrote, that suggests it was all a nice, smooth way to get to the Children and Young People Act, that the history of getting it right for every child has a smooth transition from a problem that was recognized to a solution that was tested to something that was rolled out in legislation. But it's not as simple as that. Getting it right for every child is a series of principles. It's a call to explore, to find new ways of actually trying to deliver for children and young people. And that call goes back at least a decade. It goes back to when the first Pathfinder was set up in Highland, where there wasn't a blueprint of how things should happen. It was a challenge to say, how can we make children and young people's lives better? Originally, coming out of a frustration that for vulnerable children and young people in particular, those children who become visible to us, or at least we act upon it, when things had gone a long way down the line, when things have really gone badly wrong. It came out of that feeling of how can we stop that? But the recognition was that's not easy. It's not a simple solution of actually picking out those vulnerable children and young people at an early stage and focusing our resources on that. It's a bit like, the way I think of it is a bit like trying to prevent forest fires. You don't know where the flame or the fire may start in a forest. And when it does, you don't know which ones are going to catch and actually cause huge amounts of damage and which ones might burn out very quickly. So what you do is you're vigilant. You look to all fires that might take place. And in thinking of it in those terms, you don't think of it just in terms of stopping the big fires, the big disasters that can happen in a child and young person's life. But that is essential, that's important. It's about recognizing that any mishaps, anything that, any crises, any risk to well-being, why wouldn't we want to pay attention to it? We don't necessarily have to do something about it, but we want it to be visible. We want to be there to offer the support that we can to children and families. And most of the time, that's very light touch. Most of the time, it's just acknowledging that something has happened and maybe not much needs to happen. But actually paying attention, knowing it, and being aware of the fact that if we didn't pay attention, it could get worse. That's where that spirit came from. That's what was tested out in Highland, where the named person service was introduced at the request of families. That's where it became a voluntary change program for many years that spread out across the whole of Scotland. But that changed when the government put out its manifesto before the last election. That changed when there was a feeling that the good practice and the tested and evaluated outcomes that were coming out of Highland weren't being picked up as quickly and as consistently across Scotland as the government would have wished. And that's why it became legislation. And in looking at that legislation, there's a series of ambitions that are embodied in those principles that lie behind the named person service. And I'm not going to talk a great deal about the nature of the service because those of you who have a particular interest in it can go along to hear Bob Fraser talk about it in one of the work streams later this afternoon. But I do want to pick out on, I guess the A word again, why we did it, where the government is coming from. And that is in taking the principles of getting it right for every child and exploring it. Now, getting it right for every child is not just about the named person or child's plan or leading professionals. It's about three very basic principles being put into practice across the whole of Scotland, and about how you can bring those principles to transform children's services. The first principle is early intervention. The basic idea that the earlier you can get in to do something, the more likely you're going to have not only good impacts, good outcomes for the child and young person, but also it's actually good for the public sector. It's good for services. Because if you leave things too long, if small concerns become challenges, if challenges become crises, then the cost of intervention and the amount of work and energy and the outcomes you're going to get out of it are going to get worse. So early intervention is hardwired into those getting it right for provisions, those provisions, by having a named person who can spot something, someone who knows the child and the family well, who can spot at an early stage if the difference between a concern that can maybe dissipate, doesn't require much action, to those which actually this is maybe a bit more serious. Actually, we need to get in there and we need to work with the child and the family to try to help. So early intervention is very much a driver behind those set of provisions. Secondly, it's about putting the child at the center. And it puts the child at the center in a very real way by having, for example, a child's plan that brings together all the different folk who are working, the professionals involved in a child and a family's life, compels them to actually sort of set out in a single planning process for those children who need all those different professionals in their lives, how they can be working together. It's a very simple notion that by the different professionals working together, coordinating their efforts, we're more likely to get better outcomes for children and young people than if they work separately, than if they just focus on their own one particular part of the business. And the third principle is the principle of well-being. Well-being is probably the most fundamental thing, in my view, or nearly the most fundamental thing, I'll come to this in a moment, about in the Children and Young People Act. Because for the first time in legislation, we've kind of said, we've not just used words like, you should act for the child's welfare or well-being. We've actually said, what do we mean by well-being? When we talk about what our aspirations are for children and young people, what it sets out in legislation, what does that mean? And what it means is that it's not about picking out one part of a child's life, whether they are safe, whether they're healthy, whether they achieve. I always lose track of the rest of the words, actually, but whether they're nurtured, whether they're active, responsive, respected, included. I mean, it sounds like a list, but the list is important because it's not about looking at one part of their lives. It's about recognizing all those parts of their lives working together. It's about a holistic view of well-being. And it's recognizing that professionals can't do their job well in focusing on whatever part of that circle of well-being that they have the expertise in, without being aware of the different aspects. Jerry McCartney presented some very powerful evidence about if you're looking at health, you can't just simply look at what goes on in the body. You need to look at environment. You need to look at issues like poverty. This is something that the government deeply believes in and is trying to act upon. And it's one of the ways it's acting upon it is by getting us all to think about well-being in that holistic way. That lies behind the getting it right for every child aspects of the legislation. But there's one other part of the legislation that is perhaps even more important, and that's to do with children's rights. For the first time in legislation, we're actually saying, no, we do these things for children and young people, not just because it's efficient for our services, not just because we want them to be good adults and citizens, what have you. It's because we recognize they deserve it. They have it because of their rights. And those rights, as expressed in the United Nations Convention on the Rights of the Child, are hardwired into the legislation through Part 1 of the Act. That places duties on ministers to think very carefully about every decision they make, everything they do, about how it fits with children's rights and well-being. And that's being taken forward by, in the first instance, we're going to be subjecting all our policies and decisions to children's rights and well-being impact assessments. We're going to be asking the question, how is this going to affect children and young people with all the decisions we take? But that duty goes beyond Scottish ministers. The duty to report on children's rights is something that will lie across the public sector. It will lie with local authorities, it will lie with health boards. And those duties will be, in a sense, saying, what are you doing to advance the rights of the child? And by making visible the rights of the child, I think that is a very powerful influence by rooting all the changes we're talking about in the Children and Young People Act, not least the changes on getting it right for every child, and by putting it on a rights-based approach, by making it, no, this is not something we choose to do because it's an add-on to our lives. This is something that's fundamental and a fundamental aspiration of Scottish society, that children and young people, they are not a luxury. They are something which are so important, they deserve these things in their own right. Now, I'm speaking to a conference of people who know this instinctively. I could be speaking to other groups of people where this may come a bit as a surprise, they may not be sure, they may be uncomfortable about this, but these principles of GERFEC, these ideas of early intervention, this idea of putting the child and the family at the center of what we're doing and looking at individual children in their own rights and looking at well-being in a holistic way. That's what all of you do in the early years. That's what all of you do with mums-to-be. So in a way, it's taking what you have learned, what you know instinctively, and telling it to all the other professionals that might work with a child and young person. And saying, no, this way of working that we've developed, that you have developed through early years, and you continue to do through things like the Early Years Collaborative, and a whole range of initiatives where there's this kind of restless energy to try to keep exploring how these principles can work in practice. Other services are catching up. And so in many respects, you could look at the legislation and say, yes, that's where we were. We're going somewhere else. We're continuing to go forward. So again, in a way, I guess, all of this, and the Children and Young People Act, is a way of finally, maybe in a comprehensive way, making children visible to services and compelling us to act and to look and to see children in the way that you have always done. Comfort breaks are important, so I'm not going to say anything more. I'll leave it at that, but thank you very much.
Phil, thank you. I think we've had a fantastic first session. I've written down some key words, early interventions, where we've just heard from Phil, and looking at making that happen. This is the world that we are from. Phil gets all of this, but you're absolutely key. We have to get everybody else understanding the importance of the child. We've heard from Minister about evidence, creating opportunities, and how really Scotland can forge ahead with some of these real improvements. And Jerry, right at the beginning, let's not do the same thing over and over again and expect different results.